The surge in the negative rumors concerning the COVID-19 vaccination recently prompted us to speak to a doctor in a bid to bring out light from the darkness surrounding the vaccination effort. My name is Umar Mukhtar Abubakar, and this is the first episode in the Education, Health and Life series. Stay tuned.
My name is Mama Jamilu, and I'm very, very happy right now being with Dr. Masu. So, we are currently talking about the COVID-19 vaccination, the myths surrounding it. Like, people have been complaining about different things. Some say after they take it, I heard of one particular person that said he knows of someone that has taken the vaccine and went limp. That the person got paralyzed.
Okay.
So the first question I would like to ask is, what are vaccines in general?
You see, vaccines are substances that are used to prevent disease.
Okay.
There are different ways in which vaccines are being produced.
Okay.
That's why you have different types of vaccines.
Yeah.
You have killed vaccines, you have live attenuated vaccines.
Okay.
Some of them are not even the organisms themselves, they are products from the organism, like tetanus.
Okay.
So they are used to prevent disease. You see, the immune system is structured naturally in such a way that when a foreign body enters into the human body, a foreign body can be, we are referring to anything that is not a natural part of the body.
Okay.
It can be a bottle. But this time around, in terms of vaccine, we are referring to organisms.
Okay.
Virus, bacteria, fungus, or parasite. You understand?
Yeah.
So the immune system is structured in such a way that when any organism enters into the body, it first of all recognizes the organism.
Okay.
It recognizes the organism and then keeps a memory of that organism again. So the immune response to the organism, when the organism enters the second time, is usually stronger and more effective than the immune response of the first time the organism enters into the body.
All right. That's great.
So what vaccines are doing is that they will inject you with a portion of the organism, either killed. Life attenuated means the organism is alive, but it's not capable of producing disease, but it can stimulate the immune system. So the immune system will keep a memory,
Okay.
like you have been infected for the first time. Not infected, you have been into the immune system has been introduced,
Okay.
is primed with the organism so that it will stimulate that immune system. So when the real organism now
Comes in,
enters,
yes.
the immune response against the organism will be effective and efficient. So it will kill the organism. So that is how vaccines work.
Okay. All right. So, currently we are having about 3 to 4 vaccines for coronavirus.
Yeah.
So why is it like that? Why can't we just have one vaccine for it?
Okay, so there are reasons. There are reasons why you have different vaccines by even if the genes you are using.
Yeah.
The genes you are using, you have genes from ABBA, you have genes from UK,
True.
you have genes from Germany, you have
Exactly.
genes from, and if you check, you find out that all of them have peculiarities.
Yeah, that's
You
right.
see, it could be. Let me give you an example of polio vaccine.
Okay.
You see, initially when they produced polio vaccine, there are two types of vaccine: OPV and IPV.
Okay.
One is stable no matter the temperature; it can withstand heat.
Wow.
The other one cannot withstand heat. So if this were in very hot environment, if you
Yeah.
carry polio vaccine is not stable under heat,
Heat.
if you bring it to Nigeria, from the airport to where they are going to store it, is going to, the potency,
Yeah. It's going to get very
it will
strong.
lose its potency.
Yeah.
You understand? So it's not good for our environment, but it will be good for those countries that are in cold environment.
Okay. I think I get
You
it
understand?
a little bit. Yeah.
And then there are different companies that produce this vaccine.
Okay.
Nigeria as a country will sit down and see which of the countries will accept the conditions. You know, there are agreements. Everybody has to
Yeah.
agree to some condition before you can purchase a vaccine from a country. You can't just go and purchase vaccine from anywhere. You understand? So maybe depends on the countries Nigeria have
Agreement.
understanding with. That will be the first condition. Second condition is there is a rush
Exactly, for the vaccine.
for the vaccine. So if you have a company that is ready to give you, you buy from the company now. And as Jamil, if you produce a vaccine, you give it a name.
Yeah, that's true.
So if it's coming to my country, it's coming with your name. Anybody that uses your name, that will be copyright, isn't it?
Yeah, true.
And then sometimes you get donations of vaccines, donation from NGOs, donation
yeah.
from other countries
From
for
the UN.
humanitarian services. You understand? So we can say Nigeria as a whole, our vaccine need for coronavirus is 5 million. But as at now, Nigeria has been able to purchase 3 million. One country or NGO has given us 1 million doses. Another country has given us 1 million doses. Is that not 5 million?
Yeah.
Now, if Canada is producing, they will bring their own with their different name. If the company that is in Canada has a different name from the company that is in France.
So that means different countries with different vaccines,
Yeah.
different names,
Yeah.
so donating
Yeah.
to solve the same problem.
Exactly.
Okay. So that means all of them are okay.
All of them are vaccines, just that they are vaccines against coronavirus
Coronavirus.
from different companies.
All right. My
Yeah.
next question is: recently, it went round that a minister actually contacted the coronavirus after getting 2 shots of a particular vaccine.
Yeah.
So, is it that the vaccines are not potent enough to fight against this virus, or I don't understand? Although, in his defense, that he said he didn't notice much symptoms. That I think he was asymptomatic all days.
Okay, so you see, when you are vaccinated,
Yeah.
let me leave coronavirus and take you to measles vaccine.
Okay.
In public health is not like clinical health. Clinical health, they take the individual as patient. But in public health, we take the community.
Community in general, public. Okay.
You understand? When we give vaccine, we are not expecting that we will see 100% coverage.
Okay.
We will be targeting a percentage, maybe 95%, 98%.
Okay.
There must be a safe level in which when the community gets vaccinated, even those few people that are not vaccinated will be protected.
Oh, wow. Okay.
That is one. Secondly, when you are vaccinated, just like I told you, the essence of vaccination is to prime the immune system. Even if an individual is going to get the disease, is going to get the milder form of the disease. I don't know how you understand.
Yeah, I'm getting it.
So you can see a child that has been vaccinated for measles, full vaccination, but he will still come down with subclinical measles. He will come down with signs and symptoms of measles, but they are not life-threatening. So an individual can be fully vaccinated, but he will come down with disease that is not life-threatening.
Okay, so that means we should still be taking our face mask seriously.
Exactly.
Okay.
Exactly.
Yeah. My other question is: some people are complaining of different health complications after taking the vaccine. Some are complaining of fever. Some are complaining of running temperature generally. So I don't really know. Is it that is it due to our immune system being different, or I don't know if you can shed the light on that.
Okay, so a drug is any substance which, when taken into the body, is capable of changing anatomical and or physiological function of the body. So anything you take into the body, if you take tom-tom into your body, there are things you feel that are not the same. Every drug has a degree of side effect. Every drug has a degree of side effect. So vaccines are not left out. They are biological substances. So when they go into the body, they should stimulate reaction. Those reactions we are seeing as those headaches, muscle pain, fever, someone will be catching cold, you have joint pain. Those are side effects, but they are usually mild actually.
Okay, so
But it doesn't mean that somebody that has been vaccinated will not also come down with malaria during the same period.
okay,
So we should actually personalize.
Yeah.
An individual can be vaccinated, you have those mild symptoms, it will go. An individual can have those symptoms and it will coincide with the time you have another sickness, flu, malaria. You understand?
Yeah.
So it doesn't prevent you from.
So recently, actually, I took a break from my job, from my teaching job. So fortunately,
Yeah, then there are severe some of those side effects.
Okay.
There are severe, they are called AESI.
ASI.
Yeah, AESI. Look
What
at
does
it
it
here. So these are acute side effects that follow vaccination with if you want to look at it.
Okay, no,
So
we'll film it later.
Yeah, so these are acute side effects that come down with
Vaccination.
people that have been
But
vaccinated.
what we are interested in is we want to be certain that okay, if we get vaccinated,
Yeah.
we won't be sick. Like unlike the rumor that is currently going on, we want to be certain that okay, those are actually rumors and not that it's actually going to happen. Because a lot of people have been skeptical about collecting it. I started working with the coronavirus vaccination team at a primary health care over there. So part of the things I do notice is that when they come, they'll be like the people that come for the vaccine. They'll be like, okay, they've heard that if they take this vaccine, they'll fall ill and the rest. So you are assuring us now that okay, nothing of that nature. That maybe it's just people reacting to it. Or
Yeah,
something.
people respond to foreign bodies differently. Everybody has his biological makeup. Some may respond mildly, some will respond moderately, some will respond severely. There are a lot of myths regarding coronavirus. If you can remember when polio virus came into Nigeria, up till now that I'm talking to you, there are still misconceptions about polio vaccine.
Okay. And this one just started recently.
And then this one just started recently. And then you cannot separate public health from politics and power.
Exactly.
Because it's something that affects population. And then there's global health security.
Okay.
So you cannot separate public health from politics and power.
So in essence now, Dr. Mansour, you are actually advising the general public to get vaccinated.
Coronavirus are safe.
Safe. Okay.
Everybody should go out and get vaccinated.
Okay.
If you are vaccinated, you are rest assured that even if you are going to get the disease, it's going to be the mild form of the disease, not a life-threatening.
All right. Thank you very much, doctor.
You're welcome.
So, guys, you've heard the vaccine are totally safe. Maybe you can just come up with a headache or I don't really know, stomach pain, depending on your immune system. If your immune system is as strong as mine, trust me, you won't have anything. But if it's not as strong as yours, be like the doctor. Today we came over and we heard that the doctor went for a jogging and he came back sweating. So that means he really went out for jogging. So you work out to get your immune system strong and you eat healthy also. So thank you very much, sir.
You're welcome.